and welcome to Ask the TA, a periodic segment on HCAT where viewers can send questions for the town administrator and other town representatives to answer for the benefit of all Holliston stakeholders. I'll read the question for discussion today and then introduce my guests. The question is, what resources are available in Holliston for mental health services and how can I access them? To answer that question, I have leadership from 3 different departments in town. From Youth and Family Services, Jaclyn Winer; from the Holliston Police Department, Chief Matthew Stone; and from the Holliston Public Schools, Dr. Susan Kustka and Jariel Vergne. Welcome everyone, thank you for being here.
Thank you for having us.
Why don't we start with the schools? I think we can get into sort of some of the things that you've been working on, and at the end we'll go through each department and then come back about collaboration of all the departments.
Thank you, Travis. So as many of you remember, I started during the height of the pandemic in Holliston, and clearly students were dysregulated, the community was dysregulated, the nation, as a state we were also having problems. So one of the things shortly into my tenure here was I identified a need to hire someone to help support some of the SEL needs, social emotional learning needs of students. I drafted a job description and set out to hire the Director of SEL and Equity, Jariel Vergne, who's with me today. And then we also were able to hire a full-time school psychologist so that we now have 1 at each building. And we have numerous counselors that Jariel can talk about as well. The other thing is last year we started to develop as a community with many stakeholders involved a 2022-2027 Holliston Public Schools strategic plan. And our mission that we wrote together as a community is to collaboratively create a safe, inclusive environment that empowers all learners through innovative teaching and learning to be lifelong, active global citizens. And then we drafted a number of core values as well, and one of them relates to this work that we're talking about today. We believe in an emotionally and physically supportive, safe, and equitable school environment. So within our strategic plan that's on our website, we have 4 arches, and one of them is Arch 2, social and emotional well-being. We developed Tier 1, 2, and 3 supports. I'm going to pass it over to Jariel. He's going to talk about the work that we've been doing as a district and a community.
Sure, thanks. Well, thank you for having me. It's a pleasure to get a chance to share a little bit about the hard work that's been happening within the Holliston Public Schools. One of the things that I think is important to think about is that when we talk about mental health, schools are best situated in this preventative space. So what do I mean? So how do we create an environment where all kids flourish? That's a lot of what the work is about, that schools really want to engage in. We want to be experts in the preventative space. We want to teach. We want to be part of the educational experience that supports students around their mental health. So how does that look like in Holliston? So number one, what you would expect would be happening in school systems is happening here, right? So we have school adjustment counselors. We have school counselors. That is their name for those that may not know. So school guidance counselors, they're now referred to as school counselors. So we have school adjustment counselors, school counselors, we have BCBAs, we have school psychologists. As a team, all of those members come together and they're supporting students in very different ways. So that can be anything from educational aspects that they're teaching in small group, they're teaching in whole classroom opportunities, they're doing group work with students at different levels, they're also doing individual counseling, individual supports as well. They're also provide some case management support where we'll talk a little bit today when we get a chance to kind of hear about from Holliston Youth and Family. Oftentimes these roles, these hardworking members are also working with our external partners to kind of support our families just as well when it comes to their mental health needs. Mental health needs isn't something that just impacts the student. It oftentimes impacts the home, impacts the family, impacts the way kids receive services. So the work isn't just an in-school work. It's also work that kind of extends past the boundaries of school. But when we think about a school system, one of the things we're tasked with, and it's directly connected to our strategic plan, is let's build a system for this work. So one of the things, and I'm hoping our families are at home can see the screen, but one of the things is we are looking to build something called MTSS. And MTSS stands for Multi-Tiered System of Support. So what the ask is that every district, every school work to build a system that has multiple levels that can support students at the Tier 1, which means all students, at a middle level that means targeted, right? There might be some students that might need something targeted, and this highest level, which is a Tier 3, refers to intensive needs, intensive supports. schools are asked across the country, in Massachusetts, Department of Education is supporting schools to build this model in which we actively take approach around planning, around how do we use resources, around ensuring that we have the right data to build this kind of model for our students. And in this model, oftentimes this might mean, for instance, our Director of Student Services, Jess Beatty, has been working with our continuum programs, which is for students who receive special ed supports and services, aligning that work, right? So one of the things we want to make sure happens is that our student experience across the board is aligned, has a trajectory, and in essence, we are kind of building the same skills across the board, developmentally appropriate, but to support the mental health of our students. Building a system also calls for us looking at data. So over this past year, we've led data dialogues in conjunction with Holliston Youth and Family. We've led data dialogues at the school level, in which we've looked at some of the at-risk data that our students have completed in the community and the surveys to think about how do we align services in a different way, right? Aligning services that speak to not just student experience, but what are students experiencing across the board. So building that system is in essence what we're being asked to do and is the right work for schools, right? So I wanted to give kind of this broader conversation, because I think sometimes when we think about what are we doing around mental health, what schools can be best situated doing is to build a system and build a structure for students to receive the preventative aspects, but also to intervene and support when those situations arise. And then lastly, to be able to work with our partners here at the table to make sure that we're supporting students and families, not just in school, but outside as well, right? We know that, you know, the education doesn't just stop at 3 o'clock or 4 o'clock whenever that bell rings, but it goes throughout the day. So that's, you know, some of the work that we've been doing. You also might in the community hear about Mood Check, which is something that's been happening before, I'd say the last 2 years, but it's one of the pieces in which we do surveying of students at the 7th grade level, 8th grade level, and 10th grade, in which we look to ensure that our students who might be having some mental health issues receive the services necessary when needed. So we've been working with external partner for that. It's something that we've collaborated with Holliston Youth and Family as well. And then the last piece is just kind of working with our partners around the Metro West Health Survey to ensure that not only are schools looking at that, but our community partners get a chance to look at that data, and that our families also get a chance to look at that data. All of that data is not just school data, right? Mental health is something that is a community aspect that we all need to talk about to think about what are the best solutions for today.
Right. That's wonderfully put, and so I think, you know, we'll come back to some of those points after we get through Youth and Family Services and Holliston Police as well on how that interacts with everything else. As you mentioned, you know, the school bell rings and these issues still require attention, and we have other resources as well. Let me just, before we move on, you know, in response to really the question of how do we access these resources, depending on, you know, what age a child is in the school system, they be going through what process to get access to these things, or you're reaching them at the youngest age, obviously, when you see those things. But how would a parent or a guardian, you know, sort of get in touch if they felt like mental health was an issue?
So a lot of our links and resources and contacts are on the website. Jariel's created a page with a lot of social-emotional contacts. We also have a couple of resources that we share with the community, and one of those is Care Solace. So that's a 24-hour service that can be used by anyone in the Holliston community. The schools purchase that every year, and then there's links that they, if somebody's in an unsafe situation with mental wellness, counselors can refer them to that. Jackie's office, the police, our SROs can refer them, but it's on almost every counselor's communication as well as the website. They call that referral line, and if someone's in crisis, then they'll refer them after hours as well. Another resource that we'll be rolling out in the fall is the Sandy Hook Promise. So that's a free nonprofit, obviously as a reaction to Sandy Hook. It's going to allow us to send something out to the community where they can put, again, after hours 24/7 related to bullying concerns or allegations of bullying or mental wellness. They'll be able, anyone in the community will be able to send information that way, and then they will contact someone on the school side to see who's the next person in line that could get information. It might be me, if it was on the weekend or the evenings, might be a principal, and then also partnering with our police to send out maybe a wellness check, or with Youth and Family Services as well. So those are resources that will also be added to the website, but I think just knowing that some of the resources coming on the police side, we're really excited about as well.
Great. And we will be showing some links as well at the end for people to follow along with, and HCAT will help us with that. So thank you, and we'll come back as we get into collaboration at the end. But Jackie, if you want to go through what Youth and Family Services also brings to the table.
Absolutely. Thanks for having me. Holliston Youth and Family Services is a municipal department here in town. We have a mission to provide mental health resources to assess and collaborate with our community partners what's needed in the community as it relates to mental health, substance use, and wellness support for the entire community. I think Youth and Family Services is one of the best protective factors that a town can have access to. Oftentimes, our families are calling, they're not sure exactly where to turn, they're not sure where to go. We work with a lot of families with insurance barriers or other barriers that prevent them from accessing care in the community. And very often, we start with an assessment. We start with sort of what's happening, what's going on, what's bringing out some of what the needs are. And then we work with school departments, we work with guidance counselors, we work with building principals to really help consult on issues related to mental health needs, to needs that maybe coincide with special education needs. And we also do a decent amount of parent coaching and guidance work with our families. So this is where parents can sometimes just get a little bit extra support on how to alleviate some of the stressors that are happening at home. A lot of our parents that come in just are very unsure how to respond to some of those issues that are happening. They may have turned to several different sources of help prior to reaching us and haven't been successful. And so we just really kind of help families navigate the system together. Sometimes kids end up, from our initial assessment, moving into our individual treatment option, and that's where we provide outpatient counseling out of our office at 1750 Washington Street. And our therapy model tends to be more short-term, though we don't put any limitations on how long kids can access us. We're always trying to work with the child and the team that's around them. So whether that's school, a pediatrician, outside people, there are psychiatrists or psychologists that they might be working with. So we're very heavy in just sort of like the care coordination realm of things for kids. Our office also provides financial assistance grants through the Community Action Fund, and that's a wonderful program. We're so lucky to have partnership with the Community Action Fund. They are raising their own money, and they're providing grants for families that are facing hardships. So we've done things like rent and mortgage relief programs. We've done things like energy assistance. We've paid for summer camps for kids. It's a great way for a family who, is not able to access other resources in the community. If they're needing something, but they're worried about confidentiality, this is a really safe space for families to kind of come forward and get the help that they need in that way as well.
Great. Yeah. No, it reminded me, somebody said recently, my 6-year-old is watching me grow up as well as a parent. And it's very, sometimes, as you mentioned, the parents need as much assistance in dealing with the situation. So that's a great summary. Are you ready to talk as well about the drug-free community program? Sure,
yeah. Great. Our drug-free community program is a grant program. It's a national program. We were awarded it in 2022. It falls under the White House Office of the National Drug Control Policy. Holliston was awarded $625,000 for the next 5 years. And that DFC grant really focuses on 2 main goals. The first one is to establish and strengthen collaboration among community partners, and the second one is to reduce youth substance use. And so a really interesting way our department works in the community and provides some outreach in the community is we also oversee the Holliston Drug and Alcohol Awareness Coalition, where this grant kind of sits. And we just hired a coalition coordinator, Zoe Moreau. She's kind of making her rounds around town, and she's excited to get started here in the community. And her role really is to energize our 12 sectors, which is a SAMHSA term that we use to describe our collaboration with schools and churches and police and fire and youth-serving organizations and business, small business owners here in town, really with the idea in mind that Our kids are facing enormous challenges right now. They're also incredibly resilient, and there's so many protective factors and assets in this community for us to tap into, but we also have to kind of keep our eye on some of those areas of need right now as it relates to substance use and mental health needs. So this grant is absolutely going to make a huge difference here in this community in that way, and we wouldn't be able to do it without the incredible volunteers at the Holliston Drug and Alcohol Awareness Coalition. So we meet monthly, and they're working on initiatives and strategies around how to work with our community partners and collaborators. As Jariel had mentioned, we did a huge data initiative at the end of last year where we looked at our youth risk behavior survey. This is something that gets done every couple of years. It's incredibly valid and useful for us in terms of a tool to really be able to understand where is all this, what's the root? What's the need here? Where is it coming from? Why are we seeing such high levels of depression and anxiety in the community? Why do our LGBTQ and BIPOC students feel as though they're not fitting in the community and that they belong? And so this is really a way that we were able to triangulate the data and look at key priority areas that really speak to the root of the issue and the causes and concerns. And so we're kind of using that data to help us sort of build out our DFC grant and working through that with our initiatives and our partners.
That's great. And so just remind me, because I think it'll touch everybody at this table and obviously the community at large, Zoe's title again, since she's new to the
Drug-Free Communities Coalition Coordinator.
And she will be located as well at 1750 where your office is. Yep. And that's really, sort of value add to everybody at the table in terms of what we'll be able to provide the community moving forward. That's
definitely.
Great.
Thank you.
Well, we look forward to that, and I think we can wrap up with some of that as well as in terms of the resources that will come in to play there. And Chief Stone, I know you have some changes as well, also related to a different grant. So if you want to go through what HPD has been working with.
Great. Well, thanks for having us today, Travis. We've run a co-response jail diversion program at the police department since 2015. And what that is it's a combination of law enforcement and a mental health clinician that work hand in hand within the police department to appropriately respond to people in crisis. So prior to 2015, we may have been the only resource in town that somebody may have been able to call in the middle of the night after hours. Excuse me, to deal with a mental health crisis. And prior to 2015, it was police officers that were trying to basically put a Band-Aid on an issue that we really weren't trained or especially had the resources to deal with. When we implemented the civilian clinician in 2015, that really dramatically changed the way we handled mental health calls for service. Mental health calls for us and mental health follow-ups has increased tremendously in the last 8 to 10 years. Having the clinician available at a master's level really gives us the tools to provide the resources that somebody in time of crisis needs. It also helps try to deviate them from going into the criminal justice system. So somebody having a mental health episode or a mental health crisis may need more than just a visit to court or a visit to the police station. They may need a counselor. They may need a trip to the emergency room. So it's able to help redirect some of these nonviolent offenders with the help of the clinician. And it happens in real time. So we have clinicians that ride with us in the police cruiser with our officers on call. The unique situation that we have is we run it through 3 different towns. So we share the clinician with the town of Holliston, Hopkinton, and Sherburne. And the clinician is set usually work hours related to when we are seeing most of our mental health calls. But if a clinician is available to us in Holliston and the town of Hopkinton needs a clinician for a call or for a crisis call, we simply drive the clinician over to the town, share the resource, and then we're able to use it effectively in all 3 towns. What's changed in the last couple of years is because of our health calls, mental health calls in crisis have increased so much, we've decided to change our program a little bit and go for a 2-position clinician program in which we have a clinician supervisor and then we have a regular clinician. This is all paid for through a grant in the Department of Mental Health. And our hope is to have, prior to this, it was a 40-hour-a-week coverage that we had the clinician available to all 3 towns. If the grant is awarded, which we're hopeful that it will be, we'll now provide 80 hours of coverage per week for all 3 towns. This is a tremendous asset to our officers, to the community members, to follow up. And as Jariel and Jackie spoke about, mental health calls, especially for students and families, don't end Monday through Friday, 9 to 5. We're seeing issues after school. We're seeing issues on weekends. We're seeing issues on during the summertime when kids don't have the structure that they're used to at schools. Sometimes, kids are taking off their medications for one reason or another so we see during the summertime months, our mental health calls seem to increase. So having the availability of these two clinicians for us is going to allow us to provide a lot more coverage and a lot more follow-up than we are now. So we're excited. We're hopefully to hear about the grant in mid-June or mid-July, and we'll be posting those two positions rather shortly.
That's great. So we're excited to hear that, and once we have final word, we'll make sure that gets messaged out. I think obviously I've had the opportunity to sit down and see some of the changes. I think it is about call volume, right? I think the former, I think it was called advocates that you used. Everybody is sort of tapped out in this field that you're all here to discuss, and so really increasing the service level, I think, is what we're hearing across the board, from the changes made at the schools to additional resources now going to be available to support youth and family services at 1750, and then across the board, including police. So I think one thing that I'd like to highlight as I have you all here is that just like a call that goes over in your instance of Hopkinton, Holliston, and Sherburne, you can't just say it ends at a line, it ends at a time. You're all working together, and so I think in that instance, I know that there's a few that have come up already between some of the links that we'll share and the resources you provided. But if anybody would like to highlight some of the ways in which you all collaborate, I think that would be really helpful for most of the viewers to sort of see. Sure, go ahead.
Well, I wanted to kind of address a previous question, but I think it leads into this. You asked the question of, anyone in the community, how do they receive support? And one of the pieces I think that is key is that every school, between their principal, assistant principal, school counselors, some of those roles that I described, even the teachers, it first starts by just letting someone know you want to connect, right? All of our school counselors, all of our school adjustment counselors have direct contacts with everyone here at the table and can get the family directly connected to whatever that need may be. And it even might be, let's come in and let's chat, right? But I just wanted to provide that entry point. As in any community, you have new people who arrive to the community, or people who maybe have never accessed those services. As we see needs rising, mental health might be new for a family, right? So really one of the ways that you first get connected is to reach out to some of those support staff at the schools and just say, I'm looking to connect, I need some support. In those roles, all of those people I mentioned earlier will be able to connect directly with the people here. So that speaks directly to kind of the beginning of what collaboration looks like. It's being able to pick up the phone and call someone at Holliston Youth and Family, call someone at the police department, and say, I have a family who's looking for X, Y, and Z. What can I do? And sometimes it's just problem solving on the phone, because there is no perfect solution to any perfect thing. But many times coming together and talking about what that could look like is a start of that. So I'll pass it on.
Yeah, I think it's important too. I mean, this is the wraparound services approach, and the collaboration is so critical. We have students 6.5 hours a day, and we try to address their needs in school, but we can't address the whole child, and that's why we have to continue to reach out as a community. I do want to highlight, though, that some of the grants that Jariel has gotten the past couple of years. We've been doing a lot of training around positive behavioral intervention systems. That's a multi-year approach, and that's a tier 1. So a lot of our work on the school side is really trying to be preventative so that the kids don't get to crisis, but we know we're always going to have those tier 3 students as well. And then a lot of the work we're trying to do with our counselors is they may not be able to do one-on-one mental health support, maybe small group and peer groups, and we're trying to build some of the capacity in that area as well, because sometimes kids just need to know they're not alone as well, that someone in the classroom next to me could be feeling the same way, the anxiety or the stress that I might be feeling. So I really feel like that's the core of the work, is developing those tier 2 interventions with small groups and trying to move away from some of that one-to-one support, because students that are that dysregulated usually need something more outside of school as well, and that's how we kind of work together to find those supports.
That's great.
Just to piggyback on that, we have meetings often, whether it be through our school resource officers, whether it be through Youth and Family Services or HDAC. It's very rare that a name or a family member comes up that one of these 3 groups haven't either are familiar with or have been dealing with. So it is helpful if we deal with somebody, say, after hours on a weekend call. We may be able to pick up the phone call and call Jariel from Youth and Family Services and get a little bit more background information on a family, or what this person's going through, or what this person may have dealt with. It's also important too with our school resource officers, because sometimes we'll be aware of an event that happens over the weekend that maybe the schools aren't aware of, and for some reason or another the student may be acting out on Monday or not, having the normal schedule that they would normally have. But by having that background information of this child dealt with this over the weekend, or this family had this type of issue, we're able to address that a lot better on Monday morning, rather than, to Dr. Kuska's point, a preventative measure, rather than, maybe we take an extra time or have the guidance counselor be aware of a situation. So, and just one point that Jariel made outside, and having kids having stuff available. We run a junior police academy during the summer, which is a great opportunity. We reach out to all the guidance counselors at the schools, to Youth and Family Services, and we really try to advertise that program for kids that may not be involved either with sports or with other activities. And we run programs such as anti-bullying, and it's just an opportunity for the kids to just get out, make new friends, and have a good time. It's free for the community, so it's just another example of a collaboration where we're trying as a team of all three departments to really address these issues. So that's great.
Yeah, just it's such a nice paradigm to have, where you're trying to respond in the moment to the needs and react to what you're seeing, but you're also trying to sort of swim upstream and get ahead of what's happening. And I think we all do a really nice job of meeting frequently to talk about what are we seeing, how do we get upstream, how do we kind of approach this from a different set of eyes. So we're always thinking kind of locally what's going on, but then really trying to think in a broader term, in a bigger sense, what's missing and what do we need to kind of get some of our kids feeling better and our families getting more support. I think, between the mentoring your officers provide and the SROs provide, and our coaches and our activities and our wonderful recreational opportunities in the town, there's lots of ways to get kids connected and feeling that sense of community. And as Jariel said, it's really just about making that first step and that first call, but that is so hard for some people to do. And that's why we all have, there's different ways of accessing support in town. So if you're a little bit more uncomfortable reaching out to the school guidance counselor, that's the perfect, your Youth and Family Services is the perfect place to start, so we can help kind of build those bridges and bring those connections back full circle.
That's great. And so I think with that, some of these resources, and we can add more, and HCAT can support getting any of these things out there. I know the superintendent had mentioned Care Solace, that has a link as well that's Holliston specific. Safe and Supportive Schools, I think, summarizes and is a good access point to many of the things that Jariel had mentioned. And then there's a list of numbers here as well. And as these things change and these services are continued to be bolstered as we went through today, we can update these as well and make sure that people know where to reach out for these things. I know I-Decide, it was one thing that had been mentioned before. I'm not sure if we want to cover any more on that. And then also, I think the Wellness Council meetings have been discussed. Is there anything that the public should be aware of there if they want to get involved or be supportive?
Just a note on the resources with Care Solace. Each guidance counselor has the ability to make that referral for the family. So if they want to start just with clicking on the site and seeing what's available, they can do that. But if they would prefer to have somebody walk them through how to make that referral, they can reach out to Youth and Family Services or any of their guidance counselors for support in that way. Like anything, it's a matching service, so they're incredibly responsive. You're going to get an immediate response from Care Solace. A lot of our families like to review those resources with us and then make the call. It's just a really nice way to get an immediate support, and they are extremely good at following through with families, and they will not stop helping you until you get where you need to go. So it's a great service.
I think it's important to add, though, yes, we're offering a lot as a town, as a community, but it's not perfect, and we're always revising and refining and trying to come up with more ideas, because this is not a problem that's going away.
Right.
So we need to constantly, we're trying to be proactive, but often we're reactive.
Yeah.
So yes, we have the supports out there,
Yes.
but we're never just thinking that they're finite. We're continuing to explore more and continue to problem solve together as a community.
Yeah.
Yeah, and as you said, it just made me think, we're never done. We'll never get to a place where we say, we perfected whatever our response is to anything. I think everyone here at the table is always thinking about how do I constantly improve? How do we constantly grow, right? And even, for instance, the carousels which you brought up, staff members are also able to access that, right? Because we also know that a healthy school, healthy staff can be their full selves in front of our kids who also need us every day, right? So it's always thinking about what's an additional layer that we can think about that helps build a healthier community. That's schools, families, community members, and partners all kind of together in that.
Right.
That's great. And I would be remiss if I didn't mention on the town side as well the EAP program that we have available through Maya, which is the Employee Assistance Program as well, similarly, and we've used it as well to support some of our stakeholders on boards and committees as the special employees of the town as well. So a lot of resources, and we'll continue to update this, make sure HCAT has access to everything and gets that out to the community. So any other final words of wisdom? Okay, I think we'll come back, obviously, as needed with any significant changes. We'll be introducing some new programs to the community, and thank you so much for being with me.
Thanks for having us.
So thank you to my guests for explaining how to access critical mental health resources for Holliston stakeholders. Please check out the materials and links provided here and reach out to access these resources at any time. And thank you for watching Ask the TA on HCAT. We hope you found it informative. If you have a question that you'd like answered in a future segment, please email us at the address on the screen below. Thank you.